Coming up on Exclusive Doctors DFW, Kent, an active military veteran, was in a great deal of pain due to his shoulder, but not anymore. What got Kent back doing this in an unbelievable amount of time? You will meet Joy. At one time, she was unhealthy and weighed 285 pounds, but look at her now. Susie, a school teacher, could hardly walk around her classroom, but now Susie is back on her feet, pain-free. We will also introduce you to Michael, who had trouble seeing, but that quickly changed after seeing Dr. Philip Matthews. In the story of Tiffany, Tiffany tried numerous times to have a baby, and it finally happened, mainly due to infertility specialist Dr. Karen Lee. Plus, Diana gives thanks to a special Dallas-Fort Worth doctor that helped her get back on her feet. This and much more coming up on Exclusive Doctors DFW. Hello everyone, I'm Jim Knox, and we welcome you to this special edition of Exclusive Doctors DFW. This show is about outstanding doctors in the Dallas-Fort Worth area helping patients get back to living their lives to the fullest. Like Susie. Susie, a school teacher, could hardly walk around her classroom due to so much pain in her knee. But Susie is now back, walking pain-free, and here's the reason why.
Susie was a 54-year-old teacher who had severe osteoarthritis of her right knee. Even simple things in her life became difficult. Taking care of herself, walking up and down stairs, going from sitting to standing.
Before the surgery, I had been limping for years. I'd had my other knee replaced in 2010, and this knee I had limped for a really long time.
Susie had arthritis in all three compartments of the knee. Because the arthritis was throughout the knee, she was really indicated for complete full knee replacement. Susie elected for a robotic knee replacement. I truly believe this is the standard of joint replacement going forward. We're able to perform the knee replacement accurately and precisely, which essentially guarantees that the knee is going to last longer and work better. In robotic knee surgery, the surgeon is still performing the knee replacement, but the robot will not allow the surgeon to cut more than they're supposed to cut or cut at an inaccurate angle. It really guarantees accuracy and precision that's never been seen before in knee replacement surgery. In my experience, patients with robotic knee replacements are recovering quicker than ever before.
I had the surgery, and almost immediately I was able to get up and get around unassisted, and that didn't happen with my other knee replacement. To have it replaced by the robot gave me more flexibility and mobility very quickly, and I was able to do things that I was unable to do with the other replacement at a much faster rate.
Susie's doing amazingly well. She's able to get up and get around without any assistive devices. She's able to get back into her classroom easily, going up and down stairs and going from sitting to standing. But most importantly, she's able to enjoy her life and her life with her grandchildren.
This has helped with my job, teaching at Lakeside Middle School. I'm able to get down the hall, I'm able to walk around the room, and before, by the middle of the day, I was in too much pain to do that. I would recommend Dr. Tolson. I recommend him often, and the robot procedure. I'm telling everybody who needs a replacement, it's the best way to go.
Susie not only continues to teach, but she's also enjoying life with her grandkids. Now we turn our attention to Michael. Michael, a diabetic, had trouble seeing. That is until a special procedure performed by Dr. Philip Matthews.
I'm a diabetic. I've been a diabetic for most of my life, for 46 years. And at some point in my mid-20s, I started noticing some dots, and I wasn't sure what was going on. So I went to a regular eye doctor first, and he says, yeah, you need to go see somebody that deals with retinas. And so that's kind of what brought me to Dr. Matthews.
Michael is a patient who has had a type 1 diabetes and has had previous laser treatments. And about 8 to 10 years ago, he developed an acute loss of vision with smoky vision, as he described.
The vision when it was worse was, I mean, like a giant spider web completely covering my eye, and I could kind of see out. Other times it was just little spots here and random stuff, but it seemed to be constant, and it would often kind of settle down a little bit, and then if I did anything, or if I wrestled with my kids or did something real active, then it would stir it up a little more.
On examination, he had developed the advancements of the diabetic retinopathy, where a vitreous hemorrhage, a bleed inside the eye, occurred. This bleed, fortunately, is fixable by surgery. If it doesn't clear, you can actually, with small instrumentation, go inside the back portion of the eye and clean out and cure this problem.
You know, the laser treatments are painless, slightly irritating just because it's a bright light, but it's really easy to do. You know, in my case, it wasn't 100 episodes or anything. It was, you know, a couple here and there over the course of a couple of years. And, you know, since then, I don't think I've had to have a treatment in a number of years now.
By about 2 to 3 weeks after the surgery, his vision was back to where it was before he had the hemorrhage. And since that particular time of his life, he's not had any new complications, and he's enjoyed an excellent quality of life.
Dr. Matthews just gave me the kind of assurance I needed to deal with something as serious as your vision. Because, you know, the negative side of this, it can get really bad. I mean, untreated, it's, you know, blindness and detached retina and all of that. So I knew those were realities if I didn't address it. And he gave me the assurance that you can address this, you know, you're in good shape and we can manage this. I'd recommend him in a heartbeat.
Michael continues to see crystal clear, and he credits Dr. Philip Matthews. Coming up, a story that will bring joy into your hearts. Joy was overweight and unhealthy, but got her life back. How did she do it? We will find out next.
Ever wonder why it seems that your child always gets sick in the middle of the night or on a holiday? Or how about at work when you don't have time to make an appointment to see a doctor? And this is my favorite. You go to one of those corner urgent care centers only to be sent home to wait for a call when they can see you hours later. There really never is a good time to get sick. All you want to do is talk to a doctor quick and get relief. Well, that summarizes what Best Docs Live is all about. An online system allowing you to speak to a physician, not a nurse practitioner or physician's assistant, and have the doctor evaluate the situation, make a diagnosis, and if warranted, electronically send a prescription to your neighborhood pharmacy. No hassle, no waiting, no scheduling issues. Just go to bestdocslive.com, follow the easy navigation instructions, and resume your normal activities. So the next time the bug hits you or your family, there's only one thing you need to remember: bestdocslive.com.
In today's competitive digital world, it's more important than ever that your business stands out. And the way you do that is with video. As one of the country's leading video content providers, Identity Media Services can help you attract new clients. Adding video to your website can increase the chance of a front page Google result by 53 times. Or how about over 70% of web users will click on a link that has video over ones that do not? Give us a call for a free consultation or check us out at identitymediaservices.com.
Welcome back to this special edition of Exclusive Doctors DFW. After returning from vacation, Vince was diagnosed with a rare infection in his brain. The prognosis was not good until a certain Dallas-Fort Worth doctor stepped in to save Vince's life.
Well, the Apollo system is a unique device that we use to aspirate intracerebral hemorrhages. Basically, it's an endoscopic procedure. We place an endoscope under guidance, sort of like GPS guidance, but we place into the bleeding in the brain. And then we use this Apollo device to aspirate or suction out the hematoma. According to the company, they said that we were the first hospital and I was the first doctor in Texas to do that procedure.
I had meningitis, bacteria infection. And it was horrible. It was terrible. I was snow skiing, severe headaches. I thought it was the altitude. Then my memory stopped recording. And what I was told was that I was I had severe headaches and I wasn't thinking straight, and I was rushed to the hospital, and I ended up in intensive care, and Dr. Morgan showed up.
Vince was a patient that we had at the hospital actually up here in McKinney. He was found to have an infection in his fluid spaces in the ventricles in the brain, which is a lot of times a lethal problem. I had the idea of potentially using this Apollo device, which we use to aspirate bleeding, and I thought, why couldn't it aspirate out infectious process? And so we transferred him down to Plano, where we have this device, and we used the procedure to remove the infection from his brain, and it was extremely effective. The pre and post-op scans showed that we'd removed most of the active infection in there, and it completely turned his course around. So that was the first time nationwide anybody's used it for that specific indication. Luckily, that's not a very common problem, but in this patient's life, I really believe it saved his life because we were able to aspirate it out and get rid of the infection.
Dr. Morgan, he's just he's very knowledgeable, yet he's very friendly. Some doctors are not good with patients. He is. He's just magnificent.
That's what we do. We try to do good things and turn patients' outcomes around. And somebody that probably was not going to survive their injury, and now he's surviving and he's functional. As I understand, he's back to work and doing a lot of things that he did before. I mean, that's exciting.
I feel like I'm a dead man celebrating life, and I'm happy about that. And Dr. Morgan's Apollo procedure saved my life.
Vince continues to do well thanks to Dr. Brent Morgan. Now to someone else that is doing well, Joy. But at one time, Joy weighed 285 pounds and was very unhealthy. But that changed thanks to Dr. Brian Long at the Nicholson Clinic.
I didn't like going out. I got up to 285 pounds. I had no energy. I could get a full night's rest and I would just be exhausted all day long. I wanted to get back my life and just get down to a much healthier weight, healthier lifestyle.
Joy's story is a great one, but it's not too different from so many patients we see here all the time. I mean, she was young. She was 32 and otherwise fairly healthy, but severely obese. And the odds of her getting that weight off without a really powerful tool were pretty small.
I met Dr. Long. He was very open, very forthcoming about the different options and what to expect, and I really liked that. She
decided she was interested in gastric bypass surgery. It's a big decision, and it takes a lot of courage for a patient to make that decision and decide that I'm going to have surgery to lose weight and to get healthy. And so we worked with her and did the surgery, and she has done remarkably well since then. And it's really a credit to her. The surgery is just a tool, but that tool has to be used properly. And when somebody is really motivated, works hard, and uses that tool properly, you can have phenomenal results, and that's what she's done.
For me, I saw the results immediately. It was an amazing, wonderful feeling. Something, you get up in the mornings and you look in the mirror and it's just, oh my goodness. I did start going out. I was more comfortable in public, and I did start dating. And it was a lot of fun. It was a huge step. It was something that I didn't think I would be doing. So one date led to another, and now we're married. So it's been a huge life changer. I look forward to the afternoons when my new stepdaughter comes home and we go walking or we go bike riding. Being able to do those things and with her is just an incredible time for both of us. I also look forward to being able to have kids and know that I'll be around to watch them grow up and to be active. It's a feeling that you really can't put into words, the gratitude of that.
Joy is now happily married, and her change of life was so inspirational to her parents that they too had the same procedure Joy had at the Nicholson Clinic. Coming up, Diana was in so much pain she could not walk, but not anymore. What got her back on her feet? And you will not believe the story of Kent. A stem cell procedure by Dr. Wade McKenna had Kent doing something he loved way ahead of schedule.
In today's competitive digital world, it's more important than ever that your business stands out. And the way you do that is with video. As one of the country's leading video content providers, Identity Media Services can help you attract new clients. Our Emmy Award-winning crews are constantly working on videos ranging from corporate and marketing, commercials, medical and health, training and education. We do it all right here at the IMS studios in Dallas-Fort Worth. And because of that, we're able to save our clients hundreds and oftentimes thousands. We live in a world today where video is king, and if you don't have it on your website or in the social media space, then you're not going to be seen by potential clients. In fact, research shows that people are over 70% more likely to click on a website with video than one without. So if you want your business to be seen and to stand out from your competitors, or simply tell your business story in a professional manner, then you need to schedule a consultation with us today. Give us a call or check us out at identitymediaservices.com for more information.
There are some myths about blood pressure. A lot of people think that high blood pressure, because it's called hypertension, comes from tension, emotional tension, and that's not really true. The most common cause for hypertension is what's called essential hypertension. That's a release of chemicals from the kidneys and the adrenal gland that causes the blood pressure to go up. Stress, anxiety, and mental tension can make that worse, but it won't cause high blood pressure. It just aggravates it. People think that you can't go too low on blood pressure, but you can. Low blood pressure can be just as scary and just as bad for you as high blood pressure. You can have passing out spells. You can even have a heart attack from blood pressure going too low. So you've got to come within a normal range of too high versus too low, and only your doctor can help you figure that out for your particular case. People think that once you start high blood pressure medications, you have to stay on them, and that's not true. If you make certain health changes like a better diet, lose weight, reduce other causes of high blood pressure, you may be able to get off your high blood pressure medications.
Welcome back to this special edition of Exclusive Doctors DFW. There are a lot of people that can relate to our next story. Diana was in so much pain she could not walk. In fact, some of her days were spent in tears due to the pain, but that has now changed.
Well, in 2001, I had a back surgery, my first one, and I have a spondylolisthesis, a spinal disease. I was born with it, and they had to go in and put hardware in and fuse my lumbar, but about 6 months into it, I had 2 of the titanium screws broke. So they went back in there and replaced them, but from the time that they broke, the pain was just excruciating, and it just never got better. It just kept getting worse and worse, and I couldn't find any help. Medicine had quit working for me. I was passing out. I was throwing up from the pain. I couldn't sleep. My life was nothing. It was horrible, just horrible.
Diana, when I examined her, I mean, she could barely walk. She could barely do anything at all because she was in so much excruciating pain. She had lost so much functionality in there. The muscles weren't working, the nerves weren't working. I mean, literally nothing was working at all in her spinal cord and in her legs. And so what we did is we did a test treatment of my process to see if her nerves would even respond, if her body could actually even create that environment. Now, what we found was just amazing.
He did a trial on me just to see if my nerves would react to the treatment, and they did. I was able to sit up straight. I was able to walk straight, and I hadn't done that in years. So I started going to him and followed his process, because it is a process, and I'm doing great.
And she's basically a shell of herself now. I mean, she is just completely different, where she tells me all the time that when she goes to the bank and she goes to the grocery store, everybody doesn't recognize her. Because before, they were used to the Diana that couldn't even get around. And now, she's everywhere. And she's able to do things. And she walks around with a smile on her face. I mean, it's just priceless.
I'm able to go and do now. I've got grandchildren. I'm able to play with them. Before, you know, they had to visit me in bed, literally in bed. It makes me want to cry to think about how bad and how horrible I was living compared to now.
Dr. Ty is such a caring doctor. I tell everyone, and I mean everyone, about Dr. Ty. I do, because I get the rest of my life now of living so much better than I ever dreamed I could have ever lived before. I never dreamed in a million years I was going to receive this much help.
Diana is now pain-free and enjoying life to its fullest, as well as Kent. Kent, a military veteran, was very active, and along the way he damaged his shoulder so bad he could not even lift up his arm. That is until he had a procedure by world-renowned stem cell therapist Dr. Wade McKenna, who practices right here in the Dallas-Fort Worth area.
I had bad shoulders from the age of 20 on. I swam a lot through high school, and 40 years of small sustained abuse. And the final blow was in the swimming pool with my son, throwing him up in the air, and I felt my right shoulder go.
Kent is a young man who worked out incessantly. I mean, he's huge, he's always been huge, he's a Marine, and we were talking with Danny, he said, man, it's just hurting so bad that when he went to get something off of a low rack, his shoulder would just almost pop out. And finally convinced him that he probably needs to not wait any longer. And we got MRI of his shoulder.
He called me after the MR was done and asked me, what in the world did you do to your shoulder? He knew there was a rotator cuff tear and a labral tear, and it turned out to be a glenoid fracture and all kinds of other stuff.
So did rotator cuff reconstruction. Literally, we were worried about that he needs a new shoulder. He had so much osteochondral changes, arthritis, full thickness retracted cuff tear.
The healing process was amazing. It was faster than I thought. That being said, I'm an RN. I'm a lot better nurse than I'm a patient. He went ahead and did the left one, stem cells again on that one. Recovered quickly on that one. Everything was going great. I was coming down the stairs one night, slipped, fell, tore the right one again. So went back in, and then stem cells again on this one. I believe it was two and a half weeks post-operatively. I felt so good. I wasn't lifting, I wasn't putting any weight on it, but I had full range of motion. So I went out, got in the pool, and had my son video me swimming, and almost the cause of Dr. McKenna's heart attack.
I opened the video. Oh, Kent's in the pool. Hit play. Kent's breaststroking in the pool. And I was like, oh, I'm gonna kill him. He's supposed to still be in a sling at this point, right? He's 3 weeks out. And then he does a flip turn at the end of the pool. It comes back swimming freestyle, and I drop my phone. And it was like I'd seen a ghost. I was worried he was gonna tear his cuff up, but he obviously didn't.
To feel whole again, to feel like I'm strong enough, I can pick up my children, I can basic activities of daily life without having to worry about that pain being there. Just got back from a mission down in Houston helping the Harvey victims. Did a lot of good for a lot of people down there, and again, lifting boats and lifting people out of helicopters, just moving people that couldn't help themselves. And it was good to be able to do that and not worry about tearing it up further. It's good to be back at 100%.
Kent will definitely be the first to tell you that Dr. Wade McKenna is the leader when it comes to stem cell therapy. Coming up, Tiffany's story. For so many years, Tiffany tried to have a baby but could not, and then it finally happened. We will have the key reason why after this.
The moment you get on a flight and realize you don't need a seatbelt extender. The moment you realize you can wear whatever you want. The moment you start living your life again. The team at the Nicholson Clinic, doctors, dietitians, and counselors will be with you all the way to help you reach your weight loss goals. Your moment is here. Nicholson Clinic has teamed up with Texas General Hospital to raise the bar for patient care.
Ever wonder why it seems that your child always gets sick in the middle of the night or on a holiday? Or how about at work when you don't have time to make an appointment to see a doctor? And this is my favorite. You go to one of those corner urgent care centers only to be sent home to wait for a call when they can see you hours later. There really never is a good time to get sick. All you want to do is talk to a doctor quick and get relief. Well, that summarizes what Best Docs Live is all about. An online system allowing you to speak to a physician, not a nurse practitioner or physician's assistant. and have the doctor evaluate the situation, make a diagnosis, and if warranted, electronically send a prescription to your neighborhood pharmacy. No hassle, no waiting, no scheduling issues. Just go to bestdocslive.com, follow the easy navigation instructions, and resume your normal activities. So the next time the bug hits you or your family, there's only one thing you need to remember: bestdocslive.com.
It was really difficult for my husband and I. I was taking injections twice a day. I was also taking about 17 different supplements.
We had to find a way to take the 17 pills and how do you take that and make it 5 pills?
We narrowed it down to 6 core principal ingredients to give us the best fertility supplement on the market.
There's nothing else, all 6, no fluff.
Welcome back to Exclusive Doctors DFW. Tiffany tried for years to have a baby, but had a difficult time. But her special day came thanks to the help of infertility specialist, Dr. Karen Lee.
Oh man, it was definitely a struggle. We before we even started trying, she saw OBGYN, was it? And the OBGYN told us that she can't have children. It's not even good for her to try. So I mean, that was something that was like, yeah, right, lady, whatever.
Yeah, I was diagnosed with PCOS, again, like he said, by my OBGYN. So 3 years after we were ready to start to have children, and my OB here at the time referred us to Dr. Lee.
I met Tiffany and her husband Derek back in approximately 2010 or 11, and she came to see me for a long period of infertility. She had been diagnosed with an ovulation dysfunction called polycystic ovarian syndrome, or PCOS, and after some additional treatment, this was complicated by having a tubal or ectopic pregnancy.
Dr. Lee just ran more tests to confirm the polycystic ovarian syndrome, and we started the process. We did 2 IUIs, intrauterine insemination, and we were successful twice, but however, we had an ectopic miscarriage both times that we were successful, and so we had to move on with IVF.
Ultimately, they underwent IVF, or in vitro fertilization, and that led to a successful singleton pregnancy.
We had a little boy, his name is Caleb. He's 4 now. Caleb's very rambunctious, very questionative. He asks a million questions a day. Like, he's very talkative. I mean, it's just a beautiful thing when I look at my son and I look at my face and her face put together. It's like, oh, like, okay, this is weird. Yeah. I mean, but it's a beautiful thing.
Well, I had the pleasure of meeting Caleb earlier this year. He is a very energetic 4-year-old boy. Tiffany did have some pregnancy complications that led to a slight a preterm delivery, but ultimately after moderate NICU stay, he's doing great.
We knew that we wanted to have a family. We were willing to do whatever we had to do to have that family, and Dr. Lee helped us be successful with that.
She was so sweet.
Yeah, very,
she is so sweet, so nice, so sweet. I think the first time that we met with her, she told us, she was like, yeah, we're gonna do everything we can to get that miracle here. And after that, she had me on board with her. I was like, let's go, Dr. Lee, you are my people.
She was very honest, but very empathetic at the same time. I could tell that she cared and she was concerned about us, not just as a patient, but as people, as individuals. She was concerned for us, so that made a world of difference for me. Go see Dr. Lee, she's amazing.
Tiffany, Derek continue to do well as they try to keep up with their very active son, Caleb. Thank you for watching this special edition of Exclusive Doctors DFW. To watch more life-changing stories from these exclusive doctors, please log on to exclusivedoctorsdfw.com. So long, everyone.